I'm at the Gate Parkway Ponte Vedra Vein Institute, just one of their locations that they have in our area, the other one in Ponte Vedra. Anyway, I'm with Dr. Megan Deacon-Casey and Cristal Boatright. Thank you so much for having us today.
Thank you.
It's good to see you.
Nice to see you.
And today we're talking about, this is really interesting, I have not heard of this, pelvic congestion syndrome. So first off, I mean, we're adding varicose veins into this still, right? I did not think that that was correlated. But it is. So how does that affect women in the pelvis?
So varicose veins, you can have them in different parts of the body. And when it occurs in the pelvis, you can have what's called pelvic congestion syndrome. And as the name suggests, you get that filling of those veins in the pelvis, such as your ovarian veins and the ones that feed your uterus. And over time, because of pregnancy, women, of course, are affected. You can start to get that fullness in the pelvis related to varicose veins.
Then let's talk about symptoms, because I'm sure there might be women out there who's like, I've had kids, is this something I'm dealing with?
Absolutely, it's very common. Women can have what we call labial varicose veins, pelvic heaviness, pressure, especially when you're standing for a long time, it feels very heavy. That pain can go down to the legs. You can have urinary symptoms and painful intercourse. So it can be quite debilitating depending on the degree of symptoms.
Okay, so let's say somebody is saying, I have those symptoms. How is this treated?
Right, so because of those symptoms, we want to make sure that we're identifying the appropriate patients. And what we do is that we identify and diagnose pelvic congestion syndrome by using diagnostic imaging such as ultrasound is one way. Of course, we get the complete history and physical to see if those symptoms are truly related to varicose veins in the pelvis. So women may have chronic pelvic pain for over 6 months, and that's when we start to evaluate and see what's happening. And then we can always do what's called a venogram, where we go inside of those veins, take pictures to see what's happening with the direction of flow in those veins.
That's so amazing that you can even do that. So you mentioned that sometimes you can feel it in the legs. How does it affect the legs?
Well, actually, it can be the primary source of varicose veins in the legs.
Really?
So some women, especially after pregnancy, when they have all those pelvic symptoms, their OBGYN will tell them, you know, it will go away after pregnancy, and it kind of doesn't. It can actually get worse. And then you can start to develop those varicose veins in the leg, and typically you'll have pain in the front of the thighs that go all the way down.
Oh, wow. What about men? I mean, we're talking about, you know, it happens a lot after pregnancy. Is this something that also can happen outside of that?
Absolutely. This is not unique only to women. And because it's varicose veins that are inside of the body related to pressure, of course, genetic components, men can also see this. And this is typically manifested as what's called varicoceles. So men will have that kind of in the scrotum. Then they'll have infertility issues. So many times when you notice that men have those kinds of issues, they'll get evaluated and they'll notice that, of course, they have these varicoceles or varicose veins that are actually surrounding the scrotum, and men can have symptoms associated with that as well.
That's serious.
It is.
Okay, if somebody wants to get in touch with y'all, I know we mentioned the 2 locations, but how can they get in touch?
You can get in touch with us by giving us a call at 904-280-0600. And for everyone who's interested in this kind of therapy, we offer a free vein consultation. At least we can get that history from you and kind of consider what we need to do in terms of treatment for those symptoms.
What their options are.
Exactly.
Absolutely. Well, it was great to see you both. Thank you so much for having me today.
Thank you.
Of course. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.